Hi, I'm Dr. Gerald Minniti, and in this video I want to talk to you about breast augmentation incisions. There's four I want to talk to you about, and I want to give you briefly the pluses and minuses to each. The first incision I want to talk about is the inframammary incision. An inframammary incision is made along the bottom of the breast where the breast meets the chest wall. It's kind of a little curvy linear incision, and the benefits to this incision is that it allows the surgeon direct access to the place that he wants to go, which is under the muscle, because the bottom of that pectoralis major muscle is not too far away from that inframammary incision. So the doctor doesn't have to do a lot of surgery, and that means you don't have as much recovery. And it allows him access to that whole entire space under the muscle so that he can get that space ready for the implant. And that's the benefit to that incision. The downside is this: it's perceived as a visible and potentially visible incision by many patients. And so that's why it's not chosen, especially here in Southern California. Here in Southern California, the incision that's most popular is the periareolar or nipple incision. It's an incision that's made along the perimeter edge of the areola, kind of like a smile face. And that obviously is a great place to hide an incision whenever it's between two aesthetic units, the areola and the breast skin. However, it's an incision that requires more surgery. And specifically, the surgeon needs to divide breast tissue to get to the place where he wants to go, which is under the muscle. And so there's a little bit more operating involved. A third incision, which is very different from the first two, is an armpit or axillary incision. Armpit or axillary incisions are a great way to hide a scar in your armpit. And the good news is that not only is it a great place to hide a scar, but as they heal, they tend to heal very well and almost invisible. They kind of almost look like just a little crease in your armpit, and you already have some there now. So it's very difficult to see, especially after a year or two. However, the armpit incision, like the periareolar incision, requires a little bit more operating to get the tunnel to go from the armpit to the breast. That's number one. Number two, for women who are thinking about this incision, it is an incision that they may not want, especially if they wear a lot of sleeveless or strapless clothing. So that may not be the right incision for them. The last incision I want to talk to you about is a very unique one. It's called the belly button incision, and it's really only used for saline implants, because saline implants can be inserted through a single incision in the belly button and to perform breast augmentation. Now in 2015, most women are getting silicone gel, so that's really not an incision that we can talk about, because we can't insert a silicone gel implant through a belly button incision. Now I want to talk to you about my bias. A lot of patients want to know, well, what's the best incision? And sometimes we give best incisions based upon what we're used to. However, based on scientific literature, it seems as though the best incision to use is an inframammary incision. Inframammary incisions, as I mentioned before, require the least surgery, and therefore it is the quickest to recover from and is known to have the lowest risk of complications. And for me, what's important to me is to deliver surgery to my patients in the best way possible with the least risk of complication. So I choose inframammary incisions, and I will talk to you about that in your consultation, and then you can make the final decision.